Hi everyone, Dr. Jeff back with Alexis this week, and this week we're actually going to talk about something we see a lot of. Sometimes on x-ray we see it and it's not causing pain, it's just we call it incidental finding. But common thing we see, bone spurs.
Yeah, so we have two types of bone spurs. The first one is osteophytes, so that's when the bone kind of starts to grow around the joint. The second one is traction spurs, which is when the tendon is kind of pulling at the bone, and that can cause that bone spur to kind of grow out from the tension.
Yeah, and bone spurs themselves aren't necessarily what's causing the pain. Again, we can x-ray someone and we'll see a bone spur on their heel or on their Achilles or even their elbow, wherever it is, even in their back. And it's not necessarily causing pain. We find it, they're not having any pain in that area. So again, the bone spur itself isn't necessarily causing the pain. It's the inflammatory process or the process around that bone spur that may be causing the pain. There's really four causes. The first one we're going to talk about is osteoarthritis. It's the most common one that we see here. And this is kind of like your knee where the cartilage starts to diminish from rubbing on it. You start to lose your cartilage and the body will start to boost bone around it because bone is the most stable substance in the body, so it really wants to stabilize the joint. So it's going to produce bone. So when we take an x-ray of that, you're going to see some, around the top of your tibia or underneath your patella, you're going to see some bone spurs starting to grow, again, around the joint to try and stabilize it.
Yeah, you can also see this in your spine. So when your discs degenerate, they get a little bit smaller, and then the bone will start to grow around that to try to stabilize that joint.
Yeah, another one we see is an inflammatory process. And this is actually more of an autoimmune disorder. So the body's basically attacking itself. And this is like a rheumatoid arthritis type of degeneration. So the body attacking itself, so lots of immune cells, lots of white cells and B cells and K cells, and the body's kind of attacking itself. It's an immune response to yourself. And it's quite disfiguring, can be quite painful. This is like a rheumatoid arthritis where you're getting all the lumps and their fingers are kind of twisting and turning and bones kind of growing everywhere trying to just protect itself.
The fourth one is traction spurs. So your tendon, where it attaches to the bone, when it's under high tension, it can actually pull at the bone. So that lifts the bone off of kind of the periosteum, and the bone will fill in underneath. So that's what kind of creates that bump right where the tendon attaches, where you'll feel the bump.
Yeah, as I mentioned before, quite often we'll find bone spurs on x-rays that people didn't even know they had. And so it's not the spur that's causing the pain, it's that reaction around it. So how are we going to treat this? Well, you're going to treat it like any other type of injury. So if it's hot and swollen, you're going to put ice on it. You're going to take some Advil. You're going to rest, of course, try and rest the joint and give it some time to heal. And again, exercises, rest, anti-inflammatories, kind of the best way to go at treating this. Again, it's not the spur causing the pain, it's the reaction around the spur we have to treat to try and get it better.
Another thing we can do here at the clinic is Shockwave. Shockwave Canada states that Shockwave can help diminish the size of the bone spur as well as increase the speed of the healing. So we can use that Shockwave to help break up the calcification.
Yeah, once again, quite often we'll see bone spurs on x-rays and people will go, I've got a bone spur. And if it's not hurting, it's probably not the bone spur that's causing an issue. It's probably not going to cause an issue. People live with bone spurs all the time. But yeah, if we do find a bone spur, the best thing out there now that we have found with the news research is the Shockwave to come in. And again, a lot of people with plantar fasciitis or with tennis elbow or with Achilles tendonitis or patella tendonitis, we have found great success in treating it with Shockwave. And the whole idea is we get at it early before that traction spur starts to develop, or before the osteophytes start to form, to try and get the joint and keep the joint healthy.
Yeah. Thank you guys so much for watching. Hopefully this video has helped you understand a little bit more about bone spurs. If you like the video, don't forget to leave us a like. Don't forget to subscribe. Leave a comment if you have any feedback or ideas for future videos. And as always at Goldsworthy Wellness, we got your back.